As you guys may or may not know, recently there was a clinical trial that showed that adding immunotherapy to women with endometrial cancer to their chemotherapy for advanced and recurrent disease was beneficial. That benefit was mostly for a subset of women with endometrial cancer with something called MMR deficient tumors. Dostarlimab was FDA approved for that group of people about a year ago, if I'm not mistaken. Now it's indicated for all people with advanced or recurrent endometrial cancer, which is very exciting news because about 3/4 of patients with endometrial cancer are not going to be MMR deficient. There is still a benefit, which we see, and it's statistically significant. And so I'm very happy the FDA approved because this is a challenging cancer at times to treat, and so having another tool in our toolbox is really super helpful. We've been using chemotherapy, carboplatin and Taxol to treat endometrial cancer for quite a long time, and what's been really interesting is that although it worked many times, that duration of response in terms of how long the cancer would be away was not as good as we would hope. We didn't cure as many people as we'd like. The addition of immunotherapy has really changed that. We see durable responses, and which translates to more people being cured or disease-free longer. What the FDA has done now by approving it for all patients with endometrial cancer, it kind of expands our utility to use this tool to, for all women with endometrial cancer, not just the subset which were initially shown to benefit from it. And it's really important, honestly, it can't be underestimated how important FDA approval is, because a drug that's FDA approved is very easy to get authorized by insurance companies. Without FDA approval, you have to make arguments, and it's really, unfortunately, up to the insurance company as to whether or not they're going to pay for these drugs. And they're ridiculously expensive, and so nobody really can afford to pay the out-of-pocket costs. So this is huge news for our patients. This really has set a new standard of care. So there will not be any patients with advanced or recurrent endometrial cancer who will not receive immunotherapy as part of their upfront therapy. Bottom line, that's brilliant. What's actually really more important is for physicians like me that take care of women with endometrial cancer, there's a subset of endometrial cancers. We have not had any data showing the improvement immune checkpoint inhibitors, in simple terms, immunotherapy. The Ruby trial showed, particularly women with carcinosarcoma, that this does benefit those patients with those cancers as well. Again, a subtle small point, but people with the high risks tumors, the ones that have really we've not had any data, they've shown improvement in that cohort of women as well. So very important. As these drugs become more and more commonly used, we've realized that it can have some serious adverse side effects, things that you wouldn't normally attribute to chemotherapy for sure. So commonly we see problems with people's thyroids or problems with diarrhea, typically are relatively easy to manage. However, as we've started to use these more and more frequently, we've seen some really nasty side effects with the immunotherapy attacking the heart, causing something called myositis or heart failure. We can see it attack the lungs, the kidneys, the liver, the adrenal glands, leading to long-term permanent disability. The advice I'd give to patients and providers is monitoring for these symptoms is very important. Generally, if we hold the immunotherapy and treat with steroids, we can reverse the effect almost always, except if they're very severe toxicities, we can restart these things safely and they're effective, and we don't see typically those problems come back. So it's fascinating. I guess the advice I give to patients and providers as they're just starting to use these is don't be afraid to ask your colleagues that may have a little bit more, experience with these, and things like referrals to endocrinology and cardiology and the nephrologist, and all those things are very, very important. A place like the clinic, we are developing special teams that just deal with these adverse events. Again, they're becoming super common. And this is the wave of the future. This is how we're going to be treating cancer moving forward, is to harness the immune system to help in keeping these cancers under control. So this is going to be a problem that we're going to deal with, just like with chemotherapy. We've learned how to manage toxicity. So getting chemotherapy in 2024 is a very different thing than it was in 1970.